Hello and welcome to this video on brittle diabetes. While we say brittle diabetes, it would be better to simply call it hard to control diabetes. Brittle diabetes just being a colloquial name for the same phenomena. Diabetes falls under two types. Type 1, which is insulin dependent and where the body makes zero insulin from early childhood. Therefore, these people must have regular insulin injections or they're likely to die. The other is type 2 diabetes. In this case, the body has developed resistance to insulin and therefore cannot respond to insulin well. It's effectively the fat American stereotype. Generally speaking, brittle diabetes is used in the context of type 1 diabetes. This is because it is dependent on exogenous or injected insulin. There is an occurrence rate of about 3 in every 1,000 individuals, and it's almost only regarding those who take insulin for diabetes. This is why it's primarily used in the context of type 1. To be clear, it can occur in the context of type 2, it's just much less common. The challenge with this is that despite adhering to treatment and acting properly, the individuals who are diagnosed with brittle diabetes still have major swings in blood glucose levels and consequently the range of complications. These can include feeling shaky, nervousness, anxiety, sweating, irritability, confusion, fast heart rate, dizziness, nausea, blurred vision, weakness, headaches, seizures, unconsciousness, and more. The list is quite extensive, and it all comes down to the problem of how much glucose is in their blood and the downstream effects this has on their body. And to be clear with you, this is not how things should work, if it wasn't obvious already. The general idea behind diabetes treatment is threefold: a stable level of blood glucose, an appropriate response to changes in glucose levels, and stopping the body from changing incorrectly to the blood glucose levels. These 3 points are largely achieved by a proper diet, low in simple sugars that cause sharp, sudden changes in blood glucose levels. And since the human body of a person with type 1 diabetes does not make any insulin, injections of it. The injections come in two forms. Broadly speaking, short-acting and long-acting, although there are hybrids and newer formulations of these out there. Just in simplified terms, let's describe it this way. You have the short-acting insulin, and it's used for times when you're about to eat, since this will cause the food to lead to an increase in blood glucose. The food is full of glucose, it gets absorbed, and in very short order, you have a huge spike. Short-acting counteracts this sudden spike, and bringing it down to a more reasonable level. A long-acting insulin provides stability throughout the day by ensuring the body has a more reasonable baseline blood glucose level. This means that you get the appropriate response to changes in blood glucose levels through short-acting, stopping the body from changing incorrectly to blood glucose levels generally through long-acting, and ideally a stable level by diet, for the most part anyway. With this in mind, we now need to look at what fails and to some extent, what we know about why it does not work. If you have brittle diabetes, particularly type 1 here, you may experience one or more of the following symptoms: unpredictable, sharp changes in blood glucose levels without any obvious reason. For example, you haven't just gorged on a tub of ice cream. Frequent episodes of very high and very low blood sugar, despite it being unrelated to insulin levels. A greater frequency and probability of experiencing ketoacidosis and or hypoglycemia, neither of which is good for you. As far as causes go, we can look at it as mostly down to 3 causes. There's a psychological cause, a digestive cause, and there's a, for lack of a better word of putting it, a behavioral cause. The psychological is down to things like stress and depression. These can cause, at least temporarily, a degree of insulin resistance. It makes some sense if you think about this from a evolutionary point of view. Generally speaking, if you're stressed, at least as a caveman, it's likely due to issues around either being predated upon by, predators, or due to environmental pressure, such as there not being any food available. Therefore, having your body temporarily accommodate these by altering how well your body's using the glucose it has and decreasing its usage makes sense, although that is purely hypothetical. Then we have the digestive tract issues. One of these is simply autonomic neuropathies, and that is a damage to the nerves that are part of your autonomic system. Importantly, the autonomic system is responsible for your GI tract, and in terms of this, both the emptying of your stomach into the intestines and the functioning of the intestines themselves. This will alter how well food moves from your stomach into the intestines, and how far along in the intestines it travels, and therefore how well it absorbs. The slower the food moves through your intestines, to an extent, the slower it will be absorbed. We also have behavioral things, for example eating disorders, which rather obviously would have an effect on the blood glucose levels. We can have damage to the intestines through things like celiac disease or other autoimmune problems, damage from environmental issues, chemotherapy, all sorts of reasons. And then we have, issues around the movement of food within your GI tract full stop, above and beyond what we've mentioned. The treatment for this tends to be, split into two parts. You have the immediate solution, and you have, ideally, but not necessarily, a longer-term solution. The short-term solutions are all around getting your blood glucose levels back to normal, or at least as normal as can be achieved. This is generally done technologically, largely through things like blood glucose monitoring and insulin pumps. Yes, it may be somewhat crude, but unfortunately it's really the only practical solution. Real-time monitoring of the blood glucose levels and the insulin levels allows for the devices to figure out that you're not responding to insulin the way you're meant to, and therefore it just pumps in more to make up for the deficit, or at least deficit in response. A longer term is going to include things like psychological counseling in the case of psychological issues leading to this. In terms of, not psychological issues, you can't really do as much to fix it, and that's unfortunate. Now, there are some things that can be done. However, it's important to note that these can be done regardless of other issues, particularly around brittle diabetes, and are a sort of treatment for diabetes full stop. It's a pancreatic transplant. Yes, quite literally, another organ that you can donate if you are so willing. It can help someone's life, if not be solved in terms of diabetes, infinitely better. It is a donor pancreas transplanted into a recipient with brittle diabetes, and should, if the donation goes well, lead to insulin production and the fact that their body hopefully returns to an otherwise normal degree of functionality. Overall, brittle diabetes is largely the body just not responding to treatment the way it's supposed to, despite everything going according to plan otherwise. And to some extent, it's what we know of the cause and treatment. Unfortunately, the treatment as mentioned is somewhat limited, largely owing to the fact that it's, to a certain extent, uncontrollable. You can't stop someone from being stressed necessarily. Money can make them happy for a time, sex might give them pleasure, and food will actually give them, hypoglycemia. So of these, there's not many options that work. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please do post any comments, questions, or suggestions you have below.